Everybody, hello everybody. This is Mark Spector, President of Best Care, with our weekly audio blog. Today's topic will be agency, registry, or homemaker companion. What's the difference in Florida? Well, there are differences in Florida in terms of home care providers. Agencies and registries, or nurse registries as they're called, are overseen by the Agency of Healthcare Administration. Both types of companies are audited, surveyed. The state has control over them. They're actually licensed. Homemaker companion or companion sitter companies, as they're called, are not licensed. They pay a small fee for a registration. So what is the difference? Well, agencies and registries provide either employees of their own or 1099 independent contractors. Both provide the same type of caregivers, which are home health aides, certified nursing assistants, registered nurses, LPNs. Nurse registries are not allowed to provide therapies. That would be one of the differences. Also, the caregivers that work for an agency are considered employees. So how does that affect you, the consumer? Well, the way somebody pays their taxes really isn't of concern to the recipient of the care. Whereas an agency will issue a W-2 and withhold taxes. Nurse registries issue 1099s at the end of the year, issue them to the IRS and the caregiver, and at that point there is a record so that taxes can be paid. Companion sitter companies, they're a little different in terms of the type. They could use the 1099 model, but their caregivers, we're not even supposed to call them caregivers. The people that work with the companion sitter companies are not allowed to, by law, touch the patient. So if we're talking about private duty services, activities of daily living which require assistance, be it bathing, dressing, transferring, where you help a patient go from the bed to the chair to the kitchen, or however, whenever a caregiver has to put their hands on a patient to help them, companion sitters are by law not allowed to do that. So that wouldn't be a service you would be interested in if you needed that kind of help. So one issue that does come up when it comes to let's say the agency versus registry argument is there's no supervision. Having been an agency before and now a nurse registry, I can tell you that when it comes to private duty services, there is an illusion of supervision by agencies, whereas there was a time period where agencies used to have to provide a registered nurse to, quote, supervise the caregiver every 30 days. That got expanded to 60 days, and I think it might even be at 90 days now. There is no true supervision when it comes to an aide, so don't be fooled by that. The aide is the one who has the most training, the most skill to provide those activities of daily living. Those aren't really services that a registered nurse or licensed practical nurse provides. So even though if you use an agency, you can request supervision, or you get that supervision, that might not occur any sooner than any 60 to 90 days out, and that could usually be for just a short period of time. So if you have a caregiver that comes in, let's say Monday through Friday, 8 hours a day, a registered nurse coming in to take a look and supervise once every 90 days is not, in my opinion, true supervision. That service is also available with registries. It's just for a fee. But again, the person that's more qualified to do that service is going to be the home health aide, the certified nursing assistant, not the RN, who does more of a skilled service. So the illusion of supervision is one that gets thrown around a lot in home care, and that really shouldn't affect your choice in home care providers, because if you feel more comfortable having an RN come in and check in the home once in a while, those services are also available with the nurse registry. So if you'd like to know more or find out more information about this and any other topic, please go to our website at www.bestcare.net. That's www.bestcare.net, and I will see you next time.